Okay, thank you, Prof. Ayan. Thank you, Prof. Esterhaus, and also Dr. Hung, all of the participants from all over the world. I see there are 12 countries involved in these discussions.
20.
One health workforce in the world. Oh, 23 countries in the world. So that's a lot. I would like to share my view on the COVID-19 mitigation, acceleration of the mitigations in Indonesia. I'm the expert team leader of the COVID-19 mitigation accelerations of COVID-19 in Indonesia. And I would like to share this. I'm calling this from Papua on my trip from the airport to the Jayapura. I just returned from the West Papua to share of the data on the mitigations of COVID-19 in West Papua. And it will be also done in Papua right now. So I'd like to share the adaptations to the new habits for public health resilience, since it is the concept. Next slides. And if you look at the next slides, if you look at the national and global challenges, we have land use change, global mobility, natural disasters, climate change, and epidemic of infectious diseases, and hopefully not the man-made disasters. So these are the challenges that we are facing right now. And next slide, that start with the natural. I'm sorry, this is the trip with the long queue, with the noise, the back noise. So the COVID-19 is a natural outbreak, epidemic, and pandemic, and hopefully it's not going to be happen for future in the accident and deliberate sabotage and others. But these are the potential challenges in the future with the spectrum of the biorisk. Next slides. Next slides. Next slides. If we look at the disease of tomorrow, I call it disease of tomorrow, is the emerging infectious diseases. There are more than 30 newly emerging infectious diseases in the world since 2004. So 16 years after that, now we have 4 new emerging infectious diseases and caused millions of people casualties in the world. And this is alarming for us, and it's probably even more in the future. Next slide. Next slide. It seems that the coordination, okay. The COVID-19, so it's really a public health emergency, especially in Indonesia, when we have to face with the issue on the high risk of the disease and also the non-communicable disease, no adequate effort on navigations with the data, and also the disease treatment is more focused on the curative and the dependency of the medical devices. So that's caused the public health emergency in Indonesia. And the current focus from the curative has to be moved to the promotive and preventive measures. So it should be cost-effective, efficient, and sustainable. However, most of the countries has been late in terms of having more promotive and preventive measures rather than curative aspects. Therefore, there are a lot of casualties, and focus of the attention are more on the curative, the number of beds, ventilators, etc. But the behavior change has been minimal in the world, and I think this is the lack of approach over the world. Next slides. And One Health approach is an important one when we talk about the multisectoral approach, the human, animal, and environment. Slides. Please, the operator, follow me because I cannot look at next slides. And if you look at if we want to protect the nations, whether it's a country or regional or global, we need to improve the public health resilience, converting the public health emergency into public health resilience. Specifically for COVID-19, we have to improve the behavior change. So physical distancing, wearing mask, washing hands, and also improve the immunity, good rest, good food. So make sure that we improve that, and make sure that most of the people or the public really change their behavior. So that's the key issues rather than curative. It's better to have prevention methods. Next slides. Next slides. Yeah, we also need to improve the domestic productions, especially like for Indonesia with the technology, and we have to move the situations. Let me see. From the public health emergency to improving public health resilience through the domestic products, drug, vaccines, reagents, diagnostic kits, PPE, and artificial intelligence health. And we need to have the policy and government institutions working together to make sure this will happen. Of course, people will look at this as a late response, but it's better that we start it now. Okay, and then I'd like also to mention the PPE coveralls. Okay, so we have the PPE coveralls, the 100% made in Indonesia, the new savior for medical personnel worldwide. So within 1.5 months, we finally found that we have the local ingredients for the personal protective equipment for Indonesia, because at the beginning the PPE is the one that was looking for by many people in our country and the world, including Indonesia, and we found that we have the capacity to produce 17 million PPE per month, and the value is so high. And that's the problem that we faced. And within 1.5 months, we found that we can produce it with the high quality of products with the international standardized ISO 16604. And we sent the samples to the United States and get the certifications. And the approach itself is really a One Health approach, multisectoral approach. I led the discussions 2 weeks after the establishment of the task force, and I asked WHO representative, the Ministry of Industry, Ministry of Health, and the associations of the textile industry, and also the laboratory who can certify the products. And then within 1.5 months, finally our products internationally certified. So that's a big achievement in the time of the COVID-19 mitigations. And then also ventilators with the university networks, the Faculty of Engineering, several Faculty of Engineering in the country also work hard with the industry. And finally, we successfully produced ventilators, the national products, which passed the test by the Ministry of Health. And then it will be continued with the international standardized mechanisms to make sure that our ventilators is international standards for international commercial purposes, including for the domestic needs. So the next slides. And the approach that we used in the COVID-19 mitigation is the pentahelix collaborations. We believe with only the government role will not be successful. So that's why we put the government, the media, academia, community, private sectors work together. And to control this disease, we need to have the local communities up to the lowest level, governance in the community. Next slides. And we also found or established the big data integrator. We call it Bersatu Lawan COVID. So working together for COVID, against COVID. And this really integrations of multi-source data, pulling all together, the surveillance, the case management, the hospital management, the logistics, all together. And it's a big effort with our staff, Dewi, Nur Aisyah, and myself. We make this data integrators work very well. And I will explain later how this will show in terms of zonation that will improve the management of the situations in the country. Next slides. So we use the public health indicators as a navigation for regional risk zonations. This is a most important one, and this has been presented to the President of the Republic of Indonesia on the June 10th, and he was very happy and surprised that Indonesia has this data. So basically, the government collected the information of the data from all over the country in terms of the COVID-19 in the human. So it's from the health centers, from hospitals, and also from the surveillance. And we use the 3 indicators as suggested by the WHO: epidemiology, public health surveillance, health services. So these 15 indicators has been used, and using the local specific data. It's not a modeling, it's a real data with the collections at real time. Next slides. With this one, we make the categorizations. And next slides, please. So we convert into high risk zone, middle risk zone, low risk zone, and not affected. Especially for the not affected is the area that has not been infected, or there is no new cases reported during the 4 weeks, consecutive weeks, and 100% recovery rate. So by this one, next slides, we also include the indicators for determining priority in economic sectors, labor aspect, proportion, GRDP, and intersector linkages. Why we need this? Because we can not only see the public health aspects, but we also need to see other sectors like economy, because with the lockdown, or we call it, limited restrictions on the areas, we need to make sure that the economy later can be started while we can control the situations. And then Indonesia is a big country. We have 514 districts and cities. We cannot treat the same all over Indonesia. We need to treat differently in each districts and cities. So that's why we need to have the data of each district and cities and have a control measures differently in each one of them. Next slides. Well, let me see. So this is the navigation map, and you can see the regions in Indonesia with the high risk, medium risk, low risk, and not affected. And this is renewed every week. So the data we received every day, every moment, but we publish the risk zonation every week. So sometimes the number of the district and cities in the red zone converted into orange, and vice versa, and it can be jumped from the red to the yellow and vice versa. So that's why it's very dynamic, and it's like navigation for the leaders at the local level and also national level. So we have this strata like the district level or cities level, and then provincial level. So the province can coordinate the situations of the districts and cities under their jurisdictions. And then at national level, we have 34 provinces monitored. So we can monitor all of the 514 districts and cities, and also 34 provinces. Next slides. Well, this is the risk of the transmission impact of economy, as I mentioned before. The risk of transmission can be low and high, and then the economic impact at low and high, and we can see which area that can be opened first. So when we call new normal, we want to make sure that we will open only activities or sectors with low transmission, but with high impact. So that's on the right-hand side, the upper right-hand side. And education is the one that is very high risk transmissions and low economic impact. That's why we will not open these educations until the other sectors open and start smoothly without any jump in the cases. Next slides. So these are the economic sectors that has been open, 9 sectors. These are the sectors with low transmissions because of the nature of the sectors itself. Next slides. So this is our strategy, the precondition, so the step-by-step to implementing new normal or the starting the economy, socio-economic activities. We need to have the preconditions, the timing, the priority, the coordinations, and the monitoring evaluations. So this is the war strategy, basically. So we cannot open one area without having the preconditions. And the role of the leader of the area, which is the mayor or the district head, is really key. That we want to make sure that they have the socializations of the prevention, case spreading, case report, and then they need to see the behavior change survey, how it happens over there, and the public communications to make sure that the people are ready when we will or they will open based on the zonations. We will not open the red zones, we only open the yellow and the green ones. And in terms of the timing, it depends on the case, profile. And then the readiness of the organizations and management there, and also the preparedness of the hospitals, etc. In terms of the priority, we will open only areas that are ready. So we will not treat the same across Indonesia. And then we have coordination, central government and local governments. We want to make sure that there is no actions that taken by the local governments without in consultations with the central government, and vice versa. The central government, when we want to implement the policy, we always consult or discuss with the local authorities in terms of the readiness, because we will guide them, make sure that the situation is all under control. These are the steps that we are making, because we want to make sure with the situations that if we stop socioeconomic activities for a long time, that will create economic and social problems. The hungry men become angry men. So we want to prevent this to happen. But of course, during the pandemic, health protocol is a must. It's a must and has to be or must be implemented. Next slides. So also in terms of the economic tourism, we only start to open the nature tourism destinations only in few provinces, and we have ecotourism, etc. And we implement the health protocols strictly in those areas. Next slides. These are the examples of the zones of the regional marine and coastal conservation areas. We have 90 marine and coastal conservations and 22 marine and coastal conservations area that are not affected or no case, and then also 68 marine conservation as well. Let me see if I'm still connected. Okay, next slides. Next slide. Please go. Yes. So this is an example of the zones of the national park and nature tourism park in each province, region, national park, and we have the zone classifications of the area. So that's why it's I think probably this is the only country in the world who is big and have control mechanisms at the national level, while also local areas have know their situations using, again, the big data integration. So this is the new era. So we implement the new era in terms of the Industrial Revolutions 4.0, in terms of the data integrations for health. So we are making in the last 3 months, making this system to happen, and then input the data so that local level, when they input the data, they can see their dashboard. Same thing with the officials at the central level. We can also see the dashboard for the whole Indonesia, including any specific areas. Next slides. And so if you look at these slides, so this is change COVID-19 risk donations based on the district and cities. You can see every week we updated the situations and see the number of the districts and cities changing from time to time. So that's why if we cannot control the areas, they can move to the other zones because of the data and using that indicators. So this is using the epidemiological data analytics really to make this, like dashboard, so that we can see that if you look at the percentage of the low risk and green for the two zones, and see around 50% when we open the sectors and limited number of areas open, for example, like green and yellow, there is not much change in terms of the risk of increasing the cases in all over Indonesia. So this is the mechanisms, like it's driving a car or flying, like airplanes. We need to have the dashboard. We have the gas pedal, we have the brake pedal, we have the, couple, make sure that we smoothly run the country like a car, and we cannot, push that gas too much, because otherwise it will create problems. That's why this is the mechanisms that we develop. Next slides. And June 24th, I was invited by the president with Dr. Dewi Nur Aisyah. Dr. Dewi is our Indohun, program manager, who is a champion in this also COVID-19 data BLC, Bersatu Lawan COVID, is a platform. And the president, when he visited our office, the National Task Force, time only 3 people presented. One is our leader, Lieutenant General Doni Monardo, who is the head of the task force disaster agencies. And I presented on the innovations that we made, and also the data management and the policy in terms of from the curative into the prevention approach. And Dr. Dewi Nur Aisyah presented on the one data systems. And then he invited us to come to the palace, Indonesian palace, Merdeka Palace, to present in front of the national media. There were only, it's an honor for us, really. This is the first time of my life that being acknowledged by the president because of our hard work with the approach of the multisectoral, and to show to the world, to show to Indonesia that we are improving public health resilience, that we have based on the data when the president makes the policy. So he's very happy that he can use the scientific data when he will make the policy. And this is a public communications, and even last week he asked me and also Dr. Dewi to have an international press briefing, that which will be happen once I return to Jakarta in several days from now, or probably next week. It depends on the president's schedule. That the president would like to present to the international. This is what we are handling COVID-19 in Indonesia, and we want to make sure that the cases are kept low with the strategy of the precondition, the timing, the priority, the local and national collaborations, as well as the monitoring evaluation. So that's what Indonesia has been dealing. And last point, next slides. I want to make sure that everybody understands. Next slides, please. Indonesia is a big and prosperous nation with collective collaborations and keen togetherness and strong solidarity as its profound principles. And we want to make sure that when we together, we nurture each other, and united we prevail. So this is our strong message to everyone in the country, that we need to work together, because our enemy, we classified of our 3 enemies. The first is the virus. The second is the sectoral ego. The third is the bad news. So that's why when we can handle the media to have one target on making the news, and then for the virus, it's even easier, because when we know the virus, how they, E2 receptors, which is on the mucous membrane of the eyes, nose, and mouth. So when we have the physical distancing, wearing masks and also washing hands. So basically handling this virus is easy. This virus is deadly, is very clever, smart, but with the health protocols implemented by all people or public as majority, I'm sure this disease can be dealt with. But the most difficult one is the sectoral ego, because we are not trained to work together across sectors. And that's what I learned from One Health. And I proved myself and the team. I finally found one of the examples that we can have our own personal protective equipments produced in Indonesia, and we named it INA United, Indonesia United, and even the price is so low, and it's not only to protect the Indonesian health workers, but also the world, because we are the sixth biggest textile industry in the world. So that's why this is our power to really work on the humanity internationally. So that's my presentations. I'm sorry that it's probably take too long, and I would like to return this to Prof. Ian for your leaderships to continue. Thank you very much for your attention.